I saw here that the doctor added a new prescription to your list of medications, and so I just wanted to go over that furosemide and some things to keep in mind going home and bringing that into your lifestyle. And so I just saw here that you also are on bisoprolol and Lipitor, as well as some nitroglycerin, which you use as needed for chest pain. For furosemide, that is going to be treating your high blood pressure as well as the swelling that you have around your ankles and like lower calf area there. Something super important about this is it's really important to keep taking this, even if that swelling around your ankles and your legs goes away. The thing about having high blood pressure is that there's not really signs and symptoms that we can see, like we can see the swelling around our legs. So even if that does go away, make sure that you're still taking that medication because it can cause other health implications if you don't take it. And so something else to keep in mind with it is that it can cause a sudden drop in blood pressure when going from seated or lying down to standing. That can be increased with drinking alcohol. I saw here that you take 2 to 3 drinks per week, normally at dinner time, and so something to be aware of to stand up nice and slowly. Same with if you do any exercise in hot weather, maybe if you go on a walk outside or anything, that can also cause that drop in blood pressure, as well as standing for long periods of time. And so to help with that, that's making sure that you're getting up nice and slowly and not rushing and letting all the blood just kind of pool down. So taking that nice and slow. A lot of people refer to furosemide as the water pill because it makes people have to pee. It makes people have to go to the bathroom. And that normally happens within the first 30 minutes to 60 minutes of taking the medication. And it can again happen within the next few hours too as well. Normally it's that 30 minutes and then again within a few hours. And so it's important to time it up with your lifestyle. And so I a lot of times encourage people not to take it right before bed just because it will cause you to maybe have to wake up in the middle of the night to go to the bathroom. And so if you have somewhere to be, maybe around lunchtime, maybe trying to take the pill a little bit earlier in the morning to make sure that you have easy access to go to the bathroom. Another important thing is that furosemide needs to be accompanied with a high potassium diet. Some really good potassium-rich foods are spinach, broccoli, sweet potatoes, mushrooms, zucchinis, bananas and cantaloupe, and those fruits are also good sources of potassium, but they're also high in sugar. And so I really encourage patients to stick to more of those leafy greens, kind of the spinach, broccoli, the hearty vegetables that can provide you that potassium, but isn't necessarily associated with that high sugar content as well. And then also something really important with your furosemide is to be tracking your weight. If you find that you gain more than 3 pounds in one day, it's really important that you reach out to a healthcare provider. And so that's something that I know a lot of patients that they will log their daily weights and they'll weigh themselves every morning when they get up. That's just a really important, healthy, easy thing to keep track of. I know a lot of patients use Excel spreadsheets, and you can also enter it directly into your My Chart that's linked through OHSU as well. Something else is that this medication can cause photosensitivity, which means that you are just going to be sensitive to sunlight. So it's important that if you decide to go outside, make sure that you use some sunscreen just because your skin's going to be a bit more sensitive. And then also just with that blood pressure, I really encourage you to not just fully rely on this medication, but also be focusing again on some lifestyle adjustments. Some of those can include reducing some of the sodium that you cook with and find some sodium alternatives. Stress reduction is also a really good way of treating high blood pressure, and so doing things like meditation and mindfulness exercises in order to reduce any stress that you have in your life. Another really important thing is regular exercise. I encourage patients to do at least 30 minutes of exercise a day, if that means just going on a little walk, doing something that is perfect for your lifestyle. It doesn't have to be a run or anything strenuous, but even if it means just going on a short little walk around the neighborhood, or even if I know that you are the person who goes and gets the groceries, even if that means you going to the grocery store that day. That is 30 minutes of just walking around while you're there. And so really accompanying these medications with these lifestyle adjustments just to make sure that they're working the best that they can. And so, yeah, just a reminder again that keeping up the medication, even when those signs and symptoms aren't present of that high blood pressure. And then I also saw here that you'd like to cook with a lot of butter and like really hearty, yummy things like that too. And so there's some also diet adjustments that we can make too as well. And so instead of maybe cooking with those really high fat foods, trying alternatives like cooking with olive oil or even coconut oil or avocado oil. There's a lot of different adjustments that can happen there. Something I encourage is a Mediterranean diet is a really good one. It's a really heart healthy diet. And there's a lot of information that you can find about that on the OHSU website, and I'm more than happy to print out a handout for that as well. But please let me know if you have any more questions, and reach out to us if you have any questions about scheduling when to take that pill in the day. We're happy to work out a schedule of when is going to be best for you. Okay, thank you so much.